the day of today, with all the work and asking and questions and answers, what is the situation we are in at this moment in the work against discrimination, as you see it with your experience and as you see it in Romania at this point?
Okay. From my experience, and I've worked with Gypsy and Traveller communities in Britain for around 25 years, and as you know, I'm an academic. I think you're actually in a very positive position. I mean, obviously there's extreme forms of racism and discrimination everywhere across Central and East Europe, and Britain as well, as we've explained. But I think you're perhaps in a more positive situation to some extent than we are, because of the fact that there are initiatives aimed at integrating Roma more so that there's access to education, whereas only perhaps 5 to 10% of our Gypsy and Traveller population are accessing appropriate education. We have a very tiny number of Gypsy and Traveller professionals, so you're way ahead there. The fact that you have people who are medics, nurses and professional practitioners coming through your system immediately gives you a far better base from which to build upon in terms of engaging with anti-racism. So I think it's wonderful news. The fact as well that there is this programme out there. My university, we work on a very piecemeal basis, so all of the nurses and the professional practitioners we engage with, they have a small amount of training on Gypsy and Traveller and ethical issues. But that's really because of the fact the university we are, that we've managed to attract members of these communities, and because I work there, there's nothing so substantive as you're actually experiencing in Bucharest. So the fact you have a whole series of modules which is endorsed by your senior medical practitioners is absolutely wonderful news, and I would like to see it in the UK.
I see. How far this initiative should go? Should it be implemented all over the universities, universities? Do you see a future for this kind of studies?
I would very much like to. As I said, we've actually undertaken some small-scale work in our own institution. I think that you have a very good transferable model, which I would like to see certainly across Romania, but in fact I don't see why it cannot be used across Europe. Obviously there would need to be individual adaptations to look at each nation state and their particular needs, but I think this is highly transferable in policy terms, and I would strongly recommend it to people who are actually developing European national policies for integration of Roma. It's an extremely positive model.
Will you collaborate on the next
I would be delighted to collaborate with you. I've worked on quite a number of Gypsy and Traveller health projects, including engaging with people at grassroots community level to train women up as health advocates, working with young people to explore their aspirations, and developing training programmes. And I would be greatly honoured to be asked to engage in any programme like this with you.